This is Daniel Ballard, who will be playing YveCalai as part 2 for my upper body assessment. So, Mr. Blay, I'm going to do an assessment based on your emphysema, primarily on your heart and lungs. But I'm going to do a quick overview of just your head just to make sure that you're not experiencing any pain, everything's normal, coloring is okay. If you notice anything at all, if you would just point that out for me. I'm going to do a quick look at your eyes, your nose, and your mouth. Also just noting if there's any abnormalities, if there's any tender spots, if there's any sensitivity, all of that. For this next part, it's easiest if I have you lay down.
Kind of just lean against the wall.
We will do that with you just leaning against the wall. Depending on the easiest part, we're checking mainly for jugular vein distension and also feeling his carotid artery, just to feel that he has a normal pulse. You can also do this to see where it's actually bounding, which we can see with the light. In addition, you can also measure it to see where it's actually hitting on the chest. So for the next part, in order to actually view your chest, it's easiest if I could have you take your shirt off.
I don't want to.
Okay, so what I will do in that sense is I will go ahead and feel just to make sure that there's no abnormalities on him. So if anything is sensitive at all, just let me know. Making sure that like his sternum is centered, his clavicle is even, and all of that. I'm also going to go ahead and percuss, and you can actually hear the difference between the lungs and the heart. And right over the sternum, actually, you can hear that difference as well. And so really what I'm doing is kind of getting an idea of where just everything is anatomically and that it is all correct. I'm going to go ahead and take a listen to your heart, and then I will also listen to your lungs while I'm on this side, and then I'll end up having you turn around, okay? Right now I'm just listening to your heart, so you can breathe normal. And knowing that I've already taken his vital signs, and I would listen to this for a full 60 seconds, just to make sure that all of these are correct, but you want to listen to every point of the heart so you get not only like Erb's point, but you also get the tricuspid valve, the mitral valve, all of that. And make sure if you hear any abnormalities. Okay. And I'm going to go ahead and listen to your lungs, and you have different feels, so if you could just take a deep breath with your mouth open for me. Okay. Okay, with this, I'm listening for any type of wheezing, which would be expected, or crackles. All right, and I'm just going to do on your side as well. Okay. You can put that down, and while I'm on the front here, I'm going to go ahead and, as part of the heart, I would go ahead and check all of his pulses for the sake of time. What I'm actually doing for him is I'm actually going to go right to his radial pulses. I'm just going to feel to make sure that these are both normal, that they're both together. We want them at a 2, which is what they're feeling like right here. And then just checking your cap refill to make sure that all of your blood flow is good, which all of that seems to be okay, along with skin turgor. There's more checks for dehydration, which could be associated with other cardiac problems. So after a quick review of that, we will go ahead and move on to the posterior side.